I'm Dr. David Sola, but my patients call me Dr. Sola because that's nice and easy to remember. Right now I'm moving from Boston to Central Illinois, and I'm very excited to be starting here at Chittick Eye Care. Well, it's a little bit of a complicated background. I'm a little bit from all over the place. I was a little bit of an army brat growing up. I was born in Germany, actually, in an American military base. But I did spend my teenage years in Puerto Rico from the ages of 4 to 17 because my mom's from Puerto Rico. And then I moved to the East Coast and I spent some time in Boston, New York, and Miami. So I know all of the East Coast very well. I've been training for this for over 16 years, but my education started when I was 17. I moved to Boston and I went to college at Harvard. I did a bachelor's degree in biochemistry with a minor in Italian. Then I went to medical school at Columbia University, New York. After that, I moved back to Boston where I did my internship in internal medicine, and then I did my residency in ophthalmology at Mass Eye and Ear, and then I did my glaucoma fellowship at Bascom Palmer in Miami, and Bascom Palmer is actually currently ranked #1 in the country, which is very exciting. I was there. So for the past 7-8 years, I've been in the Boston area. I started in private practice for a year before I joined the faculty at Mass Eye and Ear at Harvard. And I've been an incredibly busy glaucoma and cataract surgeon. I'm actually one of 12 glaucoma specialists currently at Mass Eye and Ear, but despite that, I'm actually the busiest cataract and glaucoma surgeon in the service. I'm very excited to move all that experience here to Central Illinois and keep that busy practice going here. I would say the most challenging part of what I do is explaining glaucoma to patients. Glaucoma is typically a silent disease. It slowly eats your vision away without you noticing because the peripheral part of the vision is the first one to go. So I have a lot of patients who see very clearly in the center, but they're still legally blind because they've lost so much peripheral vision. And sometimes explaining to patients who still see well in the center that they need a glaucoma procedure or a glaucoma laser is incredibly challenging. But again, I love that part of things too, and it's all about patient education and explaining that if we don't do the right thing, then vision will go eventually. You know, I've done thousands of cataract surgeries and glaucoma surgeries and lasers, and I still love it. It's just that feeling of improving vision. It's so satisfying to remove that cloudy, dirty lens that patients have when they have a cataract, or even the little film behind the lens that clean it up, help patients maintain their vision. I think vision is priceless. It's one of our main senses, and just being able to restore it and maintain it in my glaucoma patients is incredibly satisfying. I'm Dr. Sola with Chittick Eye Care, and I look forward to meeting you.